See the live.
Okay.
In our life.
All right. Welcome to our board members and staff and any of our citizens who may be listening. This is our regular February board meeting. We had planned to meet in person today, but because of the weather, wanted to keep everyone safe and not have to travel, so we're doing this virtually. So we have all of our board members here. We have a quorum, so I'm going to call the meeting to order. Could we have a roll call, please?
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater,
Here.
Mr. Pig,
I'll unmute this here.
Ms. Davis.
Here.
Okay. Dr. Henry, would you mind reading the mission and vision of the health department?
Sure. The mission, JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Okay, thank you. So next item is approval of the agenda. You should have all gotten a copy. Can I have a motion to approve it and then we'll have discussion?
Motion to
Make a
approve.
motion that we approve the agenda.
Okay, so we'll have James as a motion and Ms. Davis for a second. Any discussion on the agenda that everyone received?
Mr. Chairman?
Yeah.
The item where it mentions that I will be making a statement limits me to 3 minutes. It's probably going to take a little bit closer to 5 minutes. So just wanted to let everybody know ahead of time.
Okay.
Okay.
Anything else?
So, no.
Okay, so we have a motion second to approve the agenda as written with that stipulation. Everyone in favor, please say aye.
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 Aye. Anyone opposed? Okay, so the agenda is approved. Okay, so the next item is approval of the December 21st, 2021 meeting minutes. All the board members were present. Can I have a motion to approve that agenda? Everyone should have just gotten that.
Motion to approve.
I'll second.
Okay, so motion second to approve. Any discussion?
Mr. Chairman, are you also asking about the approval of the minutes that went along with that agenda on December the 21st? I believe that's what you're talking about, right? The
No.
paperwork that we have has the minutes attached to it for that meeting.
We're approving the minutes, Ms. Davis. From
You are?
that meeting.
Okay, so then I do have something I'd like to say about the December 21st. Nope. Nope, it would be the January 20th. Okay, I'm fine with the December.
Any other discussion? Okay, all in favor of approving the December 21, 2021 meeting minutes as written, please say aye.
Aye.
Opposed? Okay,
I also say aye.
okay, thank you. Those are approved. So next is approval of the January 20th, 2022 special meeting minutes. Believe Mr. Prater was not at that meeting. I think everyone else was. So can I have a motion to approve those?
I make a motion to approve those minutes.
I'll second.
And a second, okay, thank you. So we have discussion?
Mr. Chairman?
Yes.
Yeah, on those minutes, on the second page, towards the bottom, right before adjournment. It mentions that there was a motion called to a vote. And it also mentions that I did not vote, but I was in the middle of speaking, making a comment because you had a second motion on the floor and you asked for discussion. I was in the middle of discussion when the vote was called. And so for the record, I voted no. And I was being interrupted and it was kind of chaotic. And I hope that in the future that we could do better at talking one at a time, letting people finish, asking if there's anybody that would like to say anything about what was just said, and then asking for a vote. And I think that would go along a lot better than what actually happened.
So you want us to record your vote as no?
Yes.
Correct? Can you do that for us, Ms. Pinkley, please?
Well, actually, no, that
Oh.
Mr. Deal, you cannot do that. If she did not, the minutes are what happened contemporaneous to what was going on.
Okay,
So we can't go back and record a vote that wasn't actually cast on the minutes.
okay,
Point of order
it's fine.
would be if you'll recognize me for that, Mr. Chairman, please.
Yes, ma'am.
The point of order, Chrissy, would be that, the meeting wasn't being properly conducted and I did not know that the vote was being taken. I didn't hear the vote was being taken. I was in the middle of what I was saying and needed to finish. And so
Ms.
the
Davis
vote was taken in the middle of my sentences and that's just,
The motion was called, Ms. Davis, and so at that point, then whenever Mr. Deal called for the vote, you had the obligation to yield the floor and vote. You did not do that.
But the chairman could have done this. He could have said, okay, Miss Davis, when you finish what you're saying,
But ma'am, he doesn't have to do
we're going
that.
to call this to a vote.
He doesn't have to do that.
He usurped his authority to interrupt what I was saying and didn't let me finish, which is not
And
okay
as
for a
the
chairman.
chairman who's conducting the meeting, he has the right to do that, ma'am.
He, according to Robert's Rules of Order, it's not
No, ma'am,
correct
I'm
to
sorry,
interrupt
you're
anyone
not
when
right.
they're speaking. You let them finish. That's what a meeting is all about. You let them finish. Then you ask if there is anybody that would refute that. And then actually I have an opportunity to come back and refute the refute. So we need to fully discuss
I'm
things.
sorry, Ms. Davis.
All I'm saying, we need to fully discuss things. And then when the discussion is finished, call for a vote.
Ms. Davis,
That's
the
all
motion
I'm
was
saying.
called. The motion was called to question, and at that point, under Robert's rules, discussion ceases and the voting starts. Mr. Deal asked for your vote 3 times. You did not give it.
I
So the
didn't
minute-
hear him and I wasn't finished speaking both. So the point of order is
It doesn't
the
matter.
chairman himself
You're
did
done.
not properly allow the
Mr.
discussion that was in motion. That's
Mr.
all
Deal,
I'm
you
saying.
cannot amend the minutes because they are in fact accurate as to what happened.
That's fine. Okay, so we have a motion and second to approve those minutes. All in favor, please say aye.
Aye.
Aye,
Oh, sorry, I can't vote.
correct. Thank you. Anyone opposed?
I,
All right, that passes 4-1.
3-1.
3-1, I'm sorry. Thank you. Okay, next we have approval of the,
Mr. Deal, that needs to be recorded as a 3-1-1 because Mr. Prater abstained since he was not there.
that's right. Okay, we have approval of the January 2022 expenditures. The amount I have for those is $95,927.13.
So
Make
moved.
a motion to approve.
Second.
Okay, motion and second to approve those. Any discussion?
Mr. Chairman, are those hang on one second here. The the items these that we have? Is that what you're voting on right now?
Say again, please.
Is this what you're voting on?
I can't.
Why don't
see
you
it
read the
yet.
title line of it so we know what you're holding up?
Okay, vendors for pre-approval for electronic payments.
No, that's
Yep.
not it.
Unfortunately, when I downloaded everything, that for some reason did not get downloaded for me. So exactly what payments are you talking about? Is the legal fees within those payments, Mr. Deal, sir? Since I don't have it in front of me.
These are the expenditures that were paid for January of this year in the amount that I stated.
Okay, so in particular, I would like to know if the legal fees for Ms. Coleman are included in that amount and what they were. And I
There's a
don't see,
breakdown of legal expenses in every board packet for every month for like at least the past 3 or 4 months. So you're
Yeah,
not checking your
understand
packet.
that,
here.
but I don't see
You're
it in
just
front of
delaying the
me.
meeting.
yes, I'm sorry. Go
Let's
ahead.
stall in the meeting and do your research. I mean, be prepared. You're taking up everybody's time with your unpreparedness, and it's not right.
That's not me being unprepared. I'm just asking a question to, so that people.
You
that
ask the
don't
same
have-
question every week
No,
or every month.
so
I'm
that's a concern of mine. And it is.
Then be better prepared.
It's also a concern of the constituents that I represent.
The people you represent are people I know too,
Why
Susan.
don't- They're
You need to be
asking,
prepared for these meetings properly, and you're not.
they're asking why. the
All right,
fees are
Ms.
high.
Davis,
you know what they
Davis,
are.
do you have a question?
My question is, what are the legal fees for January, please? Would you read them out loud so the public can hear them?
We got an accounting and you received the information for the legal fees that were paid for December. It was $1,002.05.
Okay, thank you very much.
All right, so can we have a vote on approving the January 2022 expenditures? All in favor, please say aye.
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 Anyone opposed? Okay, those are approved. So next is approval of the January 2022 electronic payments. The actual amount of those that I have is $404,279.88.
Motion to approve.
Second.
Okay, a motion and second to approve those. Any discussion? Hearing none. All in favor of approving those electronic payments, please say aye.
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 Aye. Anyone opposed? Okay, those are approved. So the last item we have is pre-approval of the March 2022 electronic payments. Those are estimated at $569,497.25. A motion to approve those?
I make a motion to approve those.
Second.
Second.
Second, okay. Any discussion on that?
Mr. Chairman,
Yes.
I'm noticing between that and last month, there's over $100,000 difference. Is there any particular item that jumps out that would be more just in a month's time? Why that would be so much higher this month than it was last month?
Are you talking about the actual
Yes,
payments versus the
electronic payments.
The electronic payment,
Versus the
March is
estimated.
estimated.
we have estimated and actual on both reports. What are you questioning?
Okay, so gotcha. So the actual is 580. Which one's the actual? Because it's cut off on the top of my paper. So which one is the actual 404 or 584?
For the amount that we're approving now, is that what
Yes,
you're
sir.
asking?
Yes, sir.
It's $569,497.25.
Okay, then I withdraw my question.
Okay, if no other discussion, all in favor of pre-approving those electronic payments, please say aye.
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 Anyone opposed? Okay, thanks, everybody. Those are approved. Next item's the director's report. Do we have anything?
I was just gonna say, things are going well. We are having, in terms of you guys received the respiratory report yesterday. If you have any questions, please let me know. But otherwise, we have been experiencing the same trends as we have over the last couple of weeks, which has us heading steadily down in community transmission. One thing that I would like to note to the board is that the CDC has announced that either tomorrow or early next week, they will be announcing updates to their guidelines for community transmission. So we are awaiting information coming from the CDC to ensure that we maintain our policies in accordance with their guidelines, but anticipate that we will be probably moving into orange within the next week or so, which is good news. As far as some of our other initiatives, we are steadily moving forward with our work with our behavioral health tool, Aspen, and working with our schools and doing mental health services with youth. And so we've got some great projects going. We're up and running with a lot of our health education programs, and environmental programs are getting started with doing some standards and lead testing. And so we're excited to get back to our normal flow. Thank you.
Great, that sounds good. Just for everyone's information, there are 5 reports that were prepared for the month's activities. We're not going to go into detail on those at the meeting today, but I assume people can see them on the website, correct? If they want to look. So a lot of good information about all the different things the health department does on those.
Miss
Okay.
Vollmer, could I ask you a question? You notice this, it's a public health preparedness paper that was in the packet that you guys gave us? And could we look at that for a minute? I just have a question.
I can try to pull it up on my end, Ms. Davis. I'm having difficulty seeing it on your screen.
It's a chart or a graph that has different colors on it.
I understand that.
It's the only page like that in the packet that you gave us. The rest is all wording and links and things like that. But well, in particular, I just like to acknowledge that, you know, it's a chart that goes from 212 to 2022. It indicates with a red line that the respiratory and systematic, that's indicating those kind of diseases, you know, flus, viruses, COVID, things like that, SARS. Then there's other colors for other types of diseases, you know, foodborne, other kinds of diseases that health departments deal with. And I happened to notice that in 2018 and 19, seemed like it was the highest spike ever for 164. I don't know if anybody else has this in front of you. It's kind of interesting. And then in 2020, when COVID started, it dropped down to like 59 cases for when I was talking about respiratory and systematic type diseases. In 2021, 36.
Is this the chart you're speaking of, ma'am?
Yeah, there you go. Maybe you can explain, maybe you would do better to explain that than I could. That red line going across there is kind of.
What numbers are you referring to? You're just throwing out numbers.
Yeah, that's what I want her to explain what those are. The numbers going across starting 2012. Going to
the numbers that you're looking at, ma'am, are the cases, or the communicable disease cases that were investigated across those years. And what you'll see, 2022 data is incomplete. As you can tell, we've only been, we have reporting for one full month of 2022. So
right.
Please don't take that as all of the numbers have suddenly dropped.
Sure.
And Tarek, so what you're looking at is groupings of diseases, whether that be enteric diseases, respiratory and systematic would be where you would find your COVID cases. And flu. I apologize. I don't have the full, I have not seen the full report as of yet. Vector-borne are things like tick-borne diseases and mosquito bites and others. So I would have to, this is a new report that's just been prepared for the board. And so I can look into it further to get information, but I believe that they are planning on providing more detailed report of what vectors and diseases are within each of those respective categories in the future.
So what's it referring to when it says in 2020, it says 69, what's that mean? And in 2019, it says 164.
The items it's referring to are on page 2. It's just the timelines. There aren't really any timelines on page 2. It just gives us the last 5 months. So the graph is a total for each of those years for the diseases listed on page 2, but we don't have a breakdown of those years on any of the pages. So.
Thank you, James. I apologize. This is the first time I've had a chance to review this.
It's okay.
It's not a cumulative number.
It was kind of interesting. It looked like the chart was really high in 2019 for respiratory type stuff. And then 2020 it started going down in 2021 as well.
So I am more than happy to speak with the division that put this report together and get additional information and follow up with you.
Okay, thanks.
Mm-hmm.
Okay, we can move on. Next item is new business. We have a couple items here. I want to announce to the community that we are planning to hold a town hall meeting, which will give anyone who's interested in making comments or providing information to the board will have their opportunity to do that in person. The meeting's going to be at the Hillsborough Civic Center on Wednesday, March the 9th, and will be open from 6:30 either until we're finished or until 8 o'clock. People who attend will be asked to sign in, and will have an opportunity to speak if they would like to do that. We'll have some guidelines for how this is going to work, which we will make available to everyone as soon as possible. But I wanted to at least start making people aware that this meeting is going to take place. So please keep that in mind. And if anyone needs more information on that and can't find it, please let us know. Okay, the next
Mr. Chairman, I
item.
it's a wonderful gesture. And it's going to take place at the Hillsborough Civic Center Wednesday, March the 9th. It's starting at 6:30.
That's right.
Okay, great.
Okay.
Mr. Deal, do you want to go ahead and let the public know about the procedure for the commenting and kind of the structure, what that's going to look like so that they know ahead of time?
Would you mind doing that, Christy?
Sure. So we have a standing resolution on public comments. Whenever we elect to have public comments, that's what we've traditionally followed for town hall meetings. So there will be a sign up sheet as you walk in the building where you will have to put your name, your phone number, and your address. We will then, once the town hall starts, but by the way, there's not going to be any public business conducted at the meeting. It is simply an opportunity for the public to share some feedback, positive or negative feedback, encouragement and concern. But you will be invited to speak in the order that you sign up. The comments will be limited. I believe that the resolution says 2 minutes, possibly 3. I think it's 2 though. It is not a dialogue between the speaker and the board, and there is no business that is being decided at that meeting.
So do I understand that the people aren't going to be able to get a comment back from anyone else? They can just make a comment and that's it?
That is correct. That is correct.
That's not really a town hall meeting then. Since we're not doing a business meeting, why wouldn't it behoove us to engage the public and to a
Because
conversation?
in a town hall meeting, it's an opportunity for the visitors to speak. It is not an opportunity for business to be done. And if the board is going to comment back, that is actually considered as being business. So when we don't have an agenda posted that includes any type of business, we can't, because we don't know what the comments are going to be. So it's an opportunity for the public to express encouragement and concern.
Okay, moving on. It's a statement requested by a board member. So, Ms. Davis.
Okay, as I was looking through the things that that was given to us to go over, I ran across something from the CDC, and I delved into it because it interested me. It was talking about VAERS data. And at the top of the page, if anybody wants to go back themselves and see what I'm seeing here, it's called COVID-19 Vaccine Safety in Children aged 5 to 11 years old, United States. And this report is for the month of November 3rd through December 19th of 2021. So if anybody wants to see that, they're welcome to go there, and that's the place to look for it. Anyway, in 1 month's time, I noticed that from November 3rd to December 19th, VAERS received and processed 4,249 reports of adverse events. This is from them. This is not me making this up. I'm reading right off of their page. Children aged 5 to 11 who received the Pfizer BioNTech COVID-19 vaccine, the median age was 8 years old. 44% were males. Most children received the Pfizer BioNTech COVID-19 vaccine alone, blah, blah, blah. We're going to move on. Overall, 4,149 reports were made by the parents, doctors, and or nurses or caregivers for these individuals. So they were sufficient enough for someone to make a report out. They 2.4% were so there were what they call serious, non-serious. So in the non-serious range, that things like dosages were wrong. Hang on here. And because of that, fever, vomiting, those kind of things occurred. In the more serious ones, what they were seeing was the median age was around 9 years old for 61% of these individuals. The most commonly reported conditions and diagnostic findings among the 100 most severe reported, most all had fever, 29%, vomiting, 21%, and increased troponin. I looked up that word troponin, and it's released into the blood after a heart attack. The medical term is myocardial infarction. So they're finding troponin in these children's blood, and it's causing heart problems with these children that are being reported. Among 12 serious reports were seizures, different types of seizures. That's, everybody knows what a seizure is, convulsing. And
you have 2 minutes left.
Again, I told you it's probably going to be over 3 minutes. So
that's 2 minutes.
I'm going to continue on. And here's what really stood out to me. Besides the myocarditis identified in a lot of these cases, VAERS reports 1 month this is a 1-month report. 2 dead children from the vaccine, and their age was 5 or 6 years old. It's just sad. The Tropitan, it also causes syncopia, which is blood clotting, and blood clotting is causing more problems, of course, when your blood clots. Mostly it happens to 70-year-olds, but for children, it's unheard of. Fatigue, nausea, rash, fever, vomiting, the Tropitan, as I already mentioned, chest pain, seizures, intensive care. 55% had injection reactions. 35% were within their system, abdominal pain, myalgia, chills, diarrhea, fatigue, myocarditis, vomiting. It impacted these children. And, everybody says, if it affects one life, it's not okay. And so what I would like to say is this. I know everybody, there's
5
people
minutes,
thinking
please,
that
please make your
the-
point.
I'm going to finish up with this. And it's food for thought. The 0 to 19-year-old age bracket people have, in our county, for example, have not died. They have not had a problem. Now, you
Make
give
your
the
point, Ms.
vaccine,
Davis.
and here's a possibility of fever, chills, and injection site problems, myocarditis, seizures, palsies, and why are we doing this to children? And
Okay,
that's all I
thank
have to
you.
say.
Thank you. Any other
Mr. Deal,
comments?
Mr. Deal, the agenda had reflected that Ms. Davis would have 3 and then the responding board members would have the same amount of time. She spoke for 5 minutes and 45 seconds. So any board member would be limited the same amount of time.
Okay.
I just have a question. Mr.
Yes, sir.
Chair, I have a question. And it's to Ms. Ballmer. Do we know how many children have had issues and how many have been affected and are died from COVID? Because I think, what I heard was that a number, and I presume it's nationwide, that this is correct, the numbers you were talking about, Susie, correct?
Yes.
They were nationwide numbers
In 1 month, yes.
for the nation. Okay.
Right. The VAERS
I'm just wanting to know, because it's a balance, and I do get it and I understand, and I don't want anybody injured by anything. That's what we're here for, is to try and protect as many people as we can without causing harm to others, and it's a tough balance, and you do the least amount of harm as you can and do the greatest amount of help for everybody you can. So again, my question to you, and simple, is do we know? I don't know if you have that number or have anything like that, because it's just kind of the balance of where do you draw the line? And I don't want anybody to be forced to have any vaccine. And I know we discussed this before. That's absolutely ridiculous. Everyone makes their own choices.
Thank you.
Including with the parents. They should make their own choices with their kids on that vaccine. Again, Kelly, do you have a number on that or not? I'm sorry. I'll shut up now. Thank you.
Are you asking for a number of deaths? Or are you
Yeah,
asking?
do we know? Do you have any? I'm just.
Well, I'm looking now as I'm pulling up a couple of the reports. So we don't have any deaths of children. We do have reported cases of children, and I apologize. I was just going to the section. You all receive, including Ms. Davis, a copy of our respiratory report that we receive each week. And I'm pulling that up as we speak. The number of children and so the youngest fatalities that we have had in Jefferson County are in the 20 to 29-year-old age range. But when we are looking at overall case numbers, and I apologize, I'm going back and forth between a couple of data sites, so you'll have to give me just a moment.
And that would be expected for it to be lower to the youngers because their systems are ramped up so high anyway.
Correct.
Okay.
And so one of the things I want to note is looking at the study that Ms. Davis is speaking about, of the 4,149 individuals, 97.6% were considered non-serious adverse reactions. One of the things that has been unusual about the COVID epidemic has been the fact that they have provided the links to and given information on how to report information to VAERS, because they want to document all of the potential side effects or things that might come about by having a vaccination. Typical vaccination side impacts could include a fever, soreness, or swelling at a site. So you'll have things along those lines. Of that particular report, VAERS received 2 reports of death during the analytic period. Both are under review, but these deaths occurred in 2 females, aged 5 and 6, both of whom had complicated medical histories and were in fragile health before vaccination.
So they got a
Ms.
vaccination.
Davis, I
Hold
would
on.
like to
They
finish.
got a
Ms. Davis, I would
vaccination
like to.
You're out of
to help
order.
them keep
Ms.
from
Davis,
getting
Davis,
out of
I'm
order.
utilizing.
COVID, and they died.
You're out of order, Miss
They'd
Davis.
still be alive.
You're out of order, Miss
That is so
Davis.
sad. I know I am. I'm.
Ms.
can't help
Davis,
myself.
for someone who just spoke at the very beginning of the meeting about allowing other people to finish their sentences, I would appreciate it if you would
Tony,
yield the
but
floor.
I
Thank
can't-
you.
I can't continue.
So again, as I was saying, according to the very same report that Ms. Davis just quoted, none of the data suggest a causal association between death and vaccination. So again, with the information that is reported to VAERS and that is information that is collected on any vaccination that is provided to youth and adults. Again, this is an opportunity that all participants who've received vaccines have received information as far as being able to report into the system for documentation purposes. So it would not be unusual to be receiving an enhanced number of reports. Thank you very much, Mr. Gill.
Any other comments?
Yeah, I had an unrelated one. I just wanted to say I had the opportunity to visit the Wellness Van this week. I wanted to say the ladies there were very professional, very easy to work with, and easy in, easy out. I just wanted to thank them and say it's a really nice program. We appreciate it. I had to get my son a sports physical, and everything went really smooth. So thank you all.
Okay,
Thank you. We'll make sure to pass that on.
I do have one thing off topic, and it just, can we pray for the people in Ukraine, please? That's got to be a horrible situation going on over. So I know it's way off topic. It's way out of our scope, but that's horrible. So I apologize for that.
I'd like to make one comment about the VAERS report for folks who may not be familiar with it. These are all the reports that are received by anyone getting into CDC and have not yet been investigated. And it's very easy to take these out of context. I'm not saying that there may not have been any side effects from the vaccine, but I think that people have to be very careful in how they look at the information that's there. And you can pretty much make it to whatever case you want to make out of the information. So, all right, hearing no others, do we have closed session today? No,
We do.
we do. Okay.
However, did we lose Mr. Pig, or is he just off camera? Okay, just want to make sure that, sorry.
Okay, so can we will be back.
Actually, you know what, Mr. Deal, we don't need to go into close me to tell you, there's one thing I just want to tell you about the update on the Robinson case is that the Supreme Court has asked the respondents in the case to file any objections that they might have to the transfer of the case in the stay, because the appellants have requested a stay from the Supreme Court, which would mean that that Judge the Judge Green and Cole County's judgment would not be implemented until the Supreme Court is able to make a decision. So the Supreme Court has asked that if the respondents have any objection to the transfer of the case to the Supreme Court and or to the request for a stay, they have, I believe it's until Monday, to get that on file. And then briefing will commence, assuming that the Supreme Court decides to go ahead and take it as opposed to leaving it at the Court of Appeals.
Are you talking about the state Supreme Court, Christie? or-
Correct.
Okay,
So,
all right.
so for the people that are watching, Mr. Chairman, could I kind of elaborate a little bit on that? Is that okay?
On what?
And Chrissy, I would want you to stand, ready to correct me if I'm wrong on any of it, but a lot of it is, goes over everybody's head when they hear those kind of terminologies. I just wanted to break it down to more easier terms for people to understand.
I'm happy to do that, Ms. Davis. So whenever the counties filed the notice of appeal, it was with the Western District Court of Appeals, which sits in Kansas City. That is where, if you're in Cole County, which is where Jefferson City is, and you appeal a case, it goes to the Western District Court of Appeals. But however, there is a provision in the Civil Code that allows for parties to ask for the Supreme Court of the state to hear the case if it involves something that has a statewide impact. And because we have appellants all over the state, and because it does have obviously a lasting state an impact that would apply to more than just the western half of the state, the counties that intervened and made the appeal asked for that case to go directly to the Supreme Court so that we could have a decision that applied across the state.
So you had two counties, is that correct? Which were the two counties?
No, there were
Cole
six.
County and
I
St.
think there were 6 counties actually.
Okay.
Mhm.
Originally, there was 2, but there were some other ones that added on, including you guys that wanted to add on to it,
No,
right? No?
no.
Okay. Who were the 6 counties off the top of your head, if you can name any of them? Just curious.
Jackson, St. Louis County, Jefferson. Trying to remember the other 3. You remember, Kelly?
I knew Jackson, St. Louis County. That's why I thought there were just 2.
Melanie Hutton. I'm trying to remember what.
I think Clinton County was one of them, if I remember correctly. But I'm happy to, I mean, it's on CaseNet. If you wanted to look at it, you can see who all the interveners were.
And then you had tried to join in and get some kind of a stay, and that was
Sure. So what that means is that typically whenever a case is appealed, the Court of Appeals has the ability to put a stay on the lower judgment, which means that if the trial court, in this case, Judge Green in Cole County, issued a judgment requiring certain actions to be taken, the Court of Appeals has the ability to stay that or to pause that and say, hold on, we're not going to implement the actions that are in that judgment until we can hear the appeal. So it keeps things at a status quo as to how they were during the pendency of the litigation until the higher court can make a decision as to whether or not the lower court's opinion was correct.
okay. And there was something that we did, and they said because we weren't a part of the case, it didn't apply to us or something.
Actually,
did
the
that work?
Attorney General who represents DHSS filed an objection on behalf of the state, even though the state isn't a party to the case. DHSS is, and DHSS, as you know, wanted the appeal to go up to the Western District and then eventually to the Supreme Court. But the Attorney General filed an objection on behalf of the state of Missouri, who's not a party, objecting to the stay.
Well, DHSS is a party of the state of Missouri, is it not?
It is a party. It is not the
Department.
state of Missouri.
Okay.
Christie, do we know when that might be heard by the Supreme Court?
No, I do not. It depends on whether or not there's objections filed next week and how they want to rule on those objections.
Okay, no other business? All right, can I have a motion to adjourn, please? Oh, and I'm sorry, so remind people again about the town hall, March 9th, and then our March regular board meeting will be March 24th.
I make the motion to adjourn.
I second.
Okay. Any discussion? Hearing none, all in favor of adjourning, please say aye.
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 Anyone opposed? Okay, thanks everybody for coming together today. Stay safe and we'll see you at the next meeting.